Well, good afternoon, everyone, and it's good to be back with you this afternoon. I should say at the start that I will have to leave the press conference before the end to join a video conference with colleagues from the United Kingdom, Guernsey and Jersey. But I will be able to leave you in the capable hands of the Health and Social Care Minister. Now, I'm grateful to the Treasury Minister for taking the briefing yesterday. There is some excellent cross-governmental working going on to get money out to support businesses and workers in these difficult times. We know that there is still work to do, but colleagues from Treasury and the Department for Enterprise are working tirelessly to get it done. Today, the Minister for Health and Social Care and I are really pleased to be joined by Debbie Brayshaw, who is the Director of the Children and Families Directorate of the Department of Health and Social Care. Before I hand over to Debbie, I would like to invite the Minister to update us on today's statistics. David.
Thank you, Chief Minister. The total number of tests undertaken now stands at 3,049. The total tests received back is 3,020, leaving 29 test results outstanding. The total number of new cases identified today stands at 4, which means we have total confirmed cases of 313. There are 258 people who are presumed recovered, leaving us with 34 active cases. Thank you, Chief Minister.
And thank you very much, David. As we have said from this lectern all too often, we need to look beyond daily numbers and see the trends. And at the moment, the trends also are painting a positive picture. But we must not lose our determination to continue to suppress this virus. We have done so well. We are still doing well, and we must continue to do everything we can to keep pressing the curve down. Before I hand over to Debbie, I wanted to reiterate a point that is personally very important to me. When we changed our measures last Friday, we did so for two distinct reasons. I took you through my thinking of them at the time, but it is worth just going over them again. The first reason we made the changes was to reflect on our well-being. You have heard me say 100 times now that dealing with the COVID will be a marathon and not a sprint. We need measures that are effective, of course, but that are also sustainable. We simply cannot lock down our community forever. Lockdown, especially when taken as seriously as you have been taking it, has consequences on our mental health and can, as the Chief Constable told us last week, lead to increases in real issues in our society, including domestic violence and mental health calls. The Council of Ministers and I are committed to doing what we can to mitigate these risks. This is why we will be publishing our approach to next steps before the end of the week. I should also mention that the Council of Ministers will be considering a paper tomorrow regarding sports and recreation. People have told us how important this is to them. People have told us how they believe there is more that they can do while respecting the social distancing rules. We have heard them. We have asked for legal and clinical advice and hope to be able to make announcements again before the end of the week. The second reason was about the economy. We have made no secret of that. We need the economy to restart. We will, of course, do everything we can to ensure that this happens in a manner that is safe, measured and gradual. As I said at the time, without an economy, we have no health and social care system. But the other effect of enabling sections of our community to return to earning a salary to support their families is about community morale and well-being. At this stage, I would like to hand over to Debbie to hear about some of the admirable work that she and her colleagues have been doing to increase support, advice and assistance for some of the most vulnerable members of our island community. Over to you, Debbie.
Thank you, Chief Minister, and thank you everybody for your time this afternoon. As we know, the current circumstances are unprecedented but very necessary in the response to the COVID-19 pandemic. We know that compliance with the requirements has been fantastic overall, and yet we cannot underestimate the very real challenges and additional pressures that the regulations pose to people's well-being. Staying at home, to work, to isolate, not to go to school, not go out to play, can mean that some families are sharing very limited space, and we know that is very stressful. Where paid work is lost or reduced, this may be placing a financial burden on families and individuals, and we know that too is very stressful. Those with additional needs and those with disabilities may have experienced a reduction in the external support available to them, and those with caring responsibilities, including young carers, may be finding the support limited and a strain upon them. For those who have no permanent home, it's a challenge to comply with the government advice. And for those that are already vulnerable with identified needs for support, care and protection, their regular and traditional face-to-face support networks, be that a friend, a neighbour or a professional, may not be available to them in the same way. And we know this can be very stressful. Whilst virtual ways of working help to social distance and keep in touch, this technology is not always accessible or available to those who are most vulnerable in our society. They may not have access to the internet or a device to use. We know in normal times those who are vulnerable are often unseen, unheard and isolated. And the current requirements may increase that sense of isolation. Sadly, this may mean that the likelihood of abuse, domestic abuse, neglect or significant harm may also increase. As we have heard, we know that conflict and violence and abusive behaviours can escalate when families face greater pressure and stress. The social care services are maintaining their critical and statutory functions. They continue to offer support and to make enquiries to help those who need protecting and have a right to be protected and safe. We continue to offer a 24-hour response to emergencies, and social workers and care staff are staying in touch with children, young people, vulnerable adults and families, offering any additional help that they can. Together with the Department of Education, Sport and Culture, we've worked to identify all children and young people currently known as to be vulnerable, and they've had the opportunity to continue to attend school if they want to. And our partner organisations are continuing to provide support to families also. Family Action is offering a helpline and very practical support, and St Christopher's are providing practical outreach support to care leavers to ensure they have food, they're safe and well, particularly if they are living alone. We also know that many families are managing the situation well and drawing upon the strength and resilience that maybe they never knew they actually had, and that has to be applauded. We know it's important for us to safeguard families and individuals so that when they are facing significant pressure and stress, they can continue to protect and promote the welfare of all of their family members and themselves, and that keeps all of us safe. Our services are here to support that resilience, and the department thanks everyone for all they are doing to stay safe and well. Thank you very much.
Well, thank you very much, Debbie, and please pass on my personal thanks to your colleagues. You're doing a remarkable, incredibly important work during these difficult times. Now, unfortunately, you need to step away now, but we'll hand over to the Health and Social Care Minister, who will take your questions.
Thank you very much, Chief Minister, and can I add my thanks to you, Debbie, for joining us today, and also please pass on my thanks for all the hard work that your team's doing. It's been an exceptional effort over the last few weeks, and I know you'll continue to do your best to serve the needs of the island. Turning to questions, first up, I've got Chris from Energy FM. Good afternoon, Chris.
Good afternoon, Minister. There could be parents who haven't been able to see their kids in more than a month now since restrictions were put in place on the Isle of Man. How will the easing of lockdown measures affect those families where parents have shared custody of their children?
Well, in terms at the moment with the regulations, there is nothing to stop people transferring children between households of separated parents. That was written into one of the very early regulations that was still permitted. What isn't allowed is the mixing of households. So one parent from one household going into another household of parents. I know it's caused some issues, but I would urge people to be sensible about this and make their own arrangements. There is the ability for children to be transferred. I don't know if Debbie wants to add anything to that.
No, the only thing I would add is where there's an additional difficulty where one parent may be here and one parent across in the UK, then we're offering assistance to assess those circumstances and the impact on the child.
Thank you. And many Manx residents who go into further education, they study off island. Some may be in the middle of degrees in the UK or elsewhere in the world at the moment. What are the guidelines for these students? Will the resumption of their studies depend on the consistency of coronavirus measures both here and in the country they're studying?
Well, obviously it will indeed, because it will depend upon the educational system that they're studying with. People are currently free to leave the island, but obviously there's border restrictions for people coming back in. In terms of those who are already at educational establishments, then it will depend upon the individual educational establishment and whether they are continuing with their courses, or as pretty much the entire higher education sector in the UK, with only a few exceptions, has done. They've shut down. This is something that will matter. It will depend upon the individual circumstances. But there's nothing to prevent students from travelling to undertake their studies or remaining where they are. It's just restrictions when they come back as the process they need to follow.
Thank you.
Okay, next up I've got Adrian, Isle of Man Newspapers.
Hi, David.
Hi, Adrian.
Just extending on what Chris was talking about, the Chief Minister said we simply cannot lock down our community forever, but there are many families out there wondering when they're going to get to see members of their family who are outside their immediate household. There doesn't seem to be anything in the six-step plan that's due to be published later this week, or will there be? When can people get to know how these measures are going to be relaxed?
Well, we have the strategy document coming out, which you've just referred to, Adrian, that will give more information to people. We can't put dates on things, as the Chief Minister made absolutely clear in Tynwald, because it depends what's happening on the ground. And as I've said on many occasions, this needs to be baby steps, a step at a time. And if things change, then we have to stand back, look at the situation, and reconsider the position. So we don't want to be putting dates into a document, because at the moment it's got to be taken stage by stage by stage. There is lots of social pressures out there, people not being able to see their relatives, not being able to see their friends, not being able to see their children. But it is important in the fight against this virus that we continue to ensure that we are responsible as a community. And unfortunately, as I've said all along, that does mean in some circumstances it is going to cause social issues for people in that regard.
Now, we've had a number of days when there were no cases, or I think there was one extra case over the last 6 days, and we've had 4 extra ones announced today. It's only, I know you say that you can't put too much emphasis on these individual cases, but people will be anxious about this. How much can we read into those extra figures that have been announced today?
We can't read anything into them, to be frank, Adrian, because we need to see trend data. As I think I've said on numerous occasions here at this podium, you can't take one day's figures and from that extrapolate out a direction of travel. Yeah. Just as I said when we had the figures at 0, you can't take that and suddenly say everything's fine. What you've got to do is look at a 3-day trend average across the various cases. I pointed out very clearly that we would see spikes at various points along this journey because the virus has not been eradicated in our community. There is still low levels out there. And what's important is what we see as the trend over the next few days. So over the next 4 or 5 days, that's what will matter. Okay, next up, I've got Lewis at Manx Radio.
Afternoon, Minister. The Chief Minister said today that as of next Wednesday's sailing, all repatriated residents from the UK will have been brought back. How many does that leave left asking to be repatriated from outside of the UK? And how will the process change in order to bring them home?
Well, in terms of those that are outside of the UK, the first thing they've got to do is get back into the UK. As a Crown dependency, in terms of repatriation from further abroad, we are dependent on the Commonwealth and the Foreign and Commonwealth Office, if I get it right, the Foreign and Commonwealth Office to get people back into the UK. And it is from the point of them arriving in the UK that we can then arrange for them to be repatriated. I know I've spoken to several people abroad who, instead of coming back, have decided to stay put because they believe it's safer to stay where they are than actually undertake travel at this time. So the numbers will differ. So the numbers the Cabinet Office has, quite a lot of those people have either decided to stay put or are undertaking the journey, but a figure will differ from time to time, so it's impossible to say at the moment the exact numbers. But the key thing is those that are in the UK that want to return have been offered the opportunity to do so.
Okay, my next question for Ms. Brayshaw, if that's okay.
Yeah, of course.
Late last year, you said there was a severe lack of foster carers available on the island. How are lockdown measures affecting the amount of children waiting to be fostered, and how are they being cared for at this time?
Okay, so the numbers of children, we don't have any children waiting to be fostered. Any child that needs to come into care does come into care, and we make those arrangements for them. The current situation has delayed a big recruitment campaign that we were going to start for foster carers, but that will resume once we're through the pandemic and matters return to normal. What I would say is that the foster carers that we've got are doing a fantastic job, and they're keeping the children that they are looking after safe and well, and maintaining contact with birth families for those children as well. Thank you.
Thank you.
Okay, and next up I've got Leanne from 3FM.
Good afternoon, Minister.
Afternoon, Leanne.
Oh, my phone's just fell then, excuse me. So my first question, yesterday with the Chief Minister outlining the island's 6-stage plan for its response to the outbreak, I understand you can't give specific dates, I know you've made that clear, but could you clarify in what phase the reopening of schools and nurseries would fall under?
Well, the Minister for Education will be joining and be able to speak a bit more around schools and nurseries to this press conference later in the week. In relation to that, I'm not going to start going into the individual phases in a document that hasn't yet been shared with Tynwald members and it hasn't yet been put out in public. But what I would say is there is very clear phases as to what we look, and very clear order as to which we look at things where people will be able to see where things fit in. The important emphasis with schools is that will obviously, as I think the Minister has stated on several occasions, need to look around the staffing of schools, the way schools operate, to ensure we're doing things in a clinically safe way with schools. So schools is a bit of a different situation, but the Minister for Education will be able to elaborate further on that when he joins the press conference in a few days' time.
Okay, thank you. And my second question, we've had quite a few people asking about house moves. Can you confirm if they're able to go ahead as long as appropriate social distancing measures are in place?
My understanding of the current regulations is as long as the contract has been signed and agreed, and that people and that neither party is willing to postpone it. The ideal situation is at the moment people should wherever possible be postponing house moves. They can, but obviously one of the things people may come up against is finding someone willing to do the move for them. Because I know that a lot of the various removals companies did suspend their service for a while. But I would urge people, if they are planning to move house, they should only really be doing so at this point in time if there's an absolute necessity to do so.
Thank you very much.
Next, I've got Simon from Business 365 magazine. Good afternoon, Simon.
Good afternoon, Minister. Firstly, my first question really could be aimed at yourself or Debbie. The rise in domestic violence by over 140%, I think, caught us all by surprise. Now, how are the services actually coping given such a big increase? and taking into account issues such as social distancing in safe houses, etc., are you finding sufficient secure locations for victims and children who need to be removed from the family homes, for instance?
Well, if I could just come in first before I bring in Debbie. In relation to domestic violence, as the Chief Constable explained when he last appeared at a press conference, it sounds exceptionally frightening, this figure of the 145%. But as the Chief Constable explained, the numbers generally are rather static and low, but they've gone up. So we're working from a base that isn't massive to begin with. But so the numbers aren't going up quite as much as you would expect. But the important thing is we have got services in place. We are able to respond. The police have been working very, very closely with the various services to put appropriate support in place, both for those who need to potentially move out of the family home or to support the family unit when they stay within the family home if it hasn't reached that threshold for them to be removed out. But I'll bring Debbie in.
Yes, just in response to that, it is worrying. I don't think it's unsurprising given the stress that families can find themselves under. A lot of systems and processes were already in place that would respond to those concerns. But we have done a lot of work in conjunction with the Department of Home Affairs and with third sector organisations to ensure there are sufficient facilities available that can ensure that people and families and children can stay safe in those circumstances.
And I think the other thing I would add, Simon, is yet again, it has been very much a cross-governmental approach. So it's been across departments. It's not been something that's purely been the focus of DHSC or the Department for Home Affairs. We've all been working hand in glove to ensure that appropriate services are in place for those that need to access them in order to keep them safe.
Thank you very much. Now, the second question, Minister, as we approach the situation where the Isle of Man could be emerging, hopefully, from the pandemic, do you believe there is unity within the Council of Ministers and Tynwald generally over what is the right strategy to actually remove the island from this and reopen us for business? It's obviously the timing is incredibly sensitive. Do you think there could be political problems within that?
There will always be people who have differences of opinions, and certainly politics most definitely is no different to that. As I think we all know, politics is about debate, but it's also about consensus and coming to that consensus as to how we move forward. I think Tynwald colleagues have been exceptionally receptive to many of the policies that we've brought forward under this emergency. They've been very accommodating in terms of parliamentary time, but it's quite right that those policies are scrutinised. That's what Tynwald is there for at the end of the day. And of course, unlike a lot of jurisdictions, although we do have political parties in the Isle of Man, and obviously we've got Liberal Van and representatives in Tynwald, most of us are independents. So Tynwald has always worked on a basis of individual cooperation, I think it is important as we go forward that we carry that Tynwald with us. There will always be those that disagree with certain aspects and certain things, and that's never going to change. But I do believe we reach a broad consensus on most things in order to drive things forward, and this will be no different.
Thank you very much.
Okay, next up I've got Paul from MTTV. Good afternoon, Paul.
Thank you, David. Good afternoon to you. The Chief Constable, when he was asked last week about numbers infected in the force, he gave us a number. I'd asked you the same question, and you didn't have it. And I just wanted to make sure that you just didn't have it to hand, or were you not going to publicise it? Because obviously, it's interesting to know for people at hospital how many people have had to take time off and therefore, getting isolated while they recover.
Is this around healthcare workers?
Yeah, that's about how many people off were testing positive.
Well, healthcare workers. We did show it on a graph at one of the press conferences I did last week.
Asked you if possible. You didn't answer. You said you hadn't got it.
Well, it would be broken. It would be broken down. It'll be broken down by overall health and social care. I think the figure off the top of my head, but I am doing this off the top of my head, so I'll have to clarify it for you the next time I'm here. I believe it's 48 that since the start have actually tested positive and have therefore self-isolated and then over time recovered and come back into work.
Okay.
But I will
And just ahead of my
confirm
second-
that figure to you when I'm here on Friday.
Thank you. Just ahead of my second question, can you break down those new cases, by the way? Were they in a nursing home, or were they completely random, or were they in a cluster?
I believe at least one is related to Abbotswood. But other than that, obviously it's too early in the day. As I think I've explained before, there has to be the back tracing so that there's a time delay before we know the actual background of the cases. So I don't have that yet.
I know, because some days you say straight away, yes, it's due to the nursing home. So
It depends when the test results come through. If it's in the overnight batch from the day before, and so therefore they've been declared first thing in the morning, then sometimes the contact tracing will be finished by the time we get to this press conference. If they're in the later batch in the day that also comes through, then obviously the contact tracing may not be complete, so the information isn't out there yet as to where the source of those cases particularly is.
So 4 are outside of the nursing home, as you understand it.
Well,
Okay.
we don't. Well, no, I didn't say
This
that.
is,
I didn't say, just to say, Paul, I didn't say that. I said
you
I'm
mentioned
aware that I think one of the cases is related to Abbotswood. That's not me saying that the other three aren't. We'll have to wait until we've got the data.
This comes up all the time. I know you're under this constant question about when can things restart at Nobles. We're hearing stories that there's lots of people who haven't got anything to do because they want to get on with what they normally would be doing, looking after people, and those areas are shut down. Have you got a timetable yet? Because obviously this up the road, further up the field, will be creating more problems, especially with the cancer people not being able to get through their treatment. Your comments on that?
Well, there is already work going on in the department, and I think I've referred to it before, about what services we can switch back on and when. But it has to be done on a stage basis, Paul, because we've got to ensure that we do things in a clinically correct way, particularly in relation to cancer. Obviously, as people will be aware, the screening services with cancer was one of the things that was shut down. But of course, we have dependencies within the UK for that as well, and they have suspended their screening services, which then has a knock-on effect to our services. So we are working through all the various different services that we've turned off and working through when we potentially could turn them back on. But like I say, the crucial thing is it's got to be done in a clinically safe way. And referring to cancer, I think I've stated it before and the Chief Minister has as well. One of the studies that came out of Italy was that those with cancer who contract COVID-19 are 5 times more likely to die than those without cancer. So it is absolutely essential that we balance the risks in anything that we do, and that does take time.
The UK, though, has made their commitment to restart, haven't they? Yesterday they made their commitment.
They have, but I don't think they've put a date on it. As far as I'm aware, Paul, like us, they're staging it. I think they've committed to some things, I think, on the 5th of May, but not to things further out. So any services that we need to feed into, we've got to do what's right for the island, basically, and ensure that there's some services we've kept going that the UK didn't.
Thank you.
Okay, next up, Josh from ITV.
Thank you, Minister. We've seen the headlines for this 6-phased exit strategy. I know you don't want to go into the specifics of that, but can you just clarify whether it will include information about when people can visit their family members and schools reopening, not necessarily when they will happen, but just whether they will be included?
It will give broad headlines, basically, of what's in the different phases. We're not going to go into a real detailed document because, again, it depends what actually happens on the ground. Everything is very subjective. I think, as I've stated before, we've not seen anything like this since the Spanish flu pandemic in 1919, 101 years ago. And the world has moved on a lot in those 101 years. So it's not going to be an absolutely detailed phase saying this, and this is going to come back on if we introduce this phase, because we will have to look at every single thing that we do and make sure that it's appropriate for the protection of our island. So we can't put dates around things. We're not going to give a detailed breakdown of 50 points under each phase as to what comes in. We're going to give broad headlines so people can see the direction of travel and in what order things actually come in. And social measures is under one of those phases.
Okay, thank you. And my second question, have you been receiving feedback on how repatriated residents are finding or have found their time in the Comus Hotel? And can you clarify why people are still restricted to 1 hour of exercise there, despite everyone else on the island not being time restricted?
Because it's a quarantine, Josh, first of all, and we've got to ensure that medically that we limit the risk of people coming into contact with others. in terms of policies, we have had feedback. I've had personal feedback. And as I constantly say at this podium, all policies are constantly under review. So, you know, if there's things that we can do to improve the experience of people, then they will be looked at. I've had people feeding back that that they've had a bad experience, but I've had a couple of people who've exited the Comus today as the first batch out, who have already fed back to me today that actually they were happy with the process and it worked for them. So, you know, it will differ to different individual people, but we take all that feedback on board, and if we need to tweak the process, then obviously we're open to looking at that.
But at this point, there's no initial plans to tweak it?
Everything is constantly under review, Josh. Things change on a daily basis. One of the things I've learned throughout this process is something that is absolutely cast iron on a Monday isn't necessarily cast iron by the Thursday. So it's important that we constantly look at all of the policies we're doing and we make sure that they're right for the time we're in.
Thanks very much.
Okay, thank you very much to our media colleagues. As always, I will close with a few shout outs. The first one is to Lisa Hall. Lisa's family's been in touch to say that she's been working not just as one of the COVID ward managers at the hospital, but she's also gone in to assist at Abbotswood as well. All her family, both her girls and her young grandchildren, are all exceptionally proud of her. They're missing her very, very much, as Lisa's been working very long hours and there isn't even time for FaceTime calls or messages, but they're all very proud of what she's doing and the way that she's been responding to this. Thank you very much, Lisa, for all that you've done. Also, next, I have a nomination for Singing Joe. Singing Joe runs singing dance lessons for toddlers of the island. They all love her, and since this horrible virus, she's been making videos for tots at bedtime and also doing live streams. So thank you very much, Joe, for all you've been doing for the children of our island. And also, my last shout out for today is to Ward 6. They are now the only surgical ward in the hospital, and they're caring for a mix of male and female patients from 4 different specialities. So they are doing an exceptional amount of work, and they've shown great skills and fortitude during this time. They've really pulled together, and they've really kept the hospital moving in its day-to-day operations. So can I say a huge thank you to everyone on Ward 6. These have been strange and changing times, and all of the staff across DHSC have had to adapt to a new reality. And thank you to each and every one of you, but particularly thank you at this moment in time to the Ward 6 staff. Well, thank you very much, everyone. Thank you for you joining us this afternoon. Stay safe, and I'll see you soon.